Hi, this is Dr. Bharadwaz. I am Chief Doctor at Fidicus Homeopathy. Now we will discuss on the topic of thyroid, especially hypothyroid. Thyroid gland is very important in our body. Its influence not only when you are born, it influence starts even you are in the womb. You are a fetus. Fetus is tremendously affected by thyroid gland as well. So when you are born, when you are as a child, it helps in growth, it helps in maturity, both mental and physical maturity. When you become an adult, it plays in your very vital role in your sexual life when you are adult or when you are old. So it plays a very major role in all the stages of your life. And also the importance of this thyroid hormones is there is no cell or no tissue, no organ or the no system that is not influenced by thyroid gland or thyroid hormones. So it is important for each and every part of your body, each and every stage of your life. Such is the importance of thyroid gland. Any disruption of this thyroid gland will leads to drastic changes and drastic negative effects in our life. The major one is normally you are not able to perform day-to-day activities. You are stuck in your career. You are not able to grow in your career. If you are a female, due to infertility, you are heading towards divorce. Obesity, hair loss, all these factors lead to decrease in weight value. Weight value in the sense, as a man or a woman, you have certain value with the opposite sex, so that value is decreased and you have to settle with the lower value guy. When you are a female, you mostly land into depression, PCOD, diabetes, heart attacks, all these kind of issues. But there is no need for you to worry. With very good homeopathic treatment and few changes in your lifestyle, the way you eat, the way you exercise, the way you sleep, and the way you lead a stress-free life, with the help of this you can completely reverse the pathology. So this autoimmune pathology, whatever the pathology is there, your thyroid can be completely recovered and it will produce the hormones again on its own with the help of homeopathic treatment. Your disease can be completely cured or it can be prevented from occurring again. In severe cases, it can be palliated if it is not cured with Fidicus homeopathy. Homeopathy treatment is safe, effective and affordable in case of thyroid disorders. 10% of the general population is affected by thyroid disorders. In that 10%, if you take 8 people, out of every 8 people, 7 people are women and only one guy is male in that population. It affects women more than men, and also it affects between the age group of 45 and 55 years. So this is the common demographics for thyroid disorders. Out of the people affected by thyroid disorders, 90% of the people are affected by a single disease, that is Hashimoto's hypothyroid. So we will discuss on especially on Hashimoto's hypothyroid today. What are the signs and symptoms of Hashimoto's hypothyroid? First one is weight gain. You will gain weight or you become obese. Skin will be cold, dry. It becomes dry. There is no sweating. It becomes scaly. You cannot tolerate even small amount of cold. Nails will become brittle and break easily. There is a diffused hair loss. There will be swelling and puffiness of the face. There will be cramps for your muscles. There will be joint pains and muscle stiffness as well in case of hypothyroid. Coming to gastrointestinal symptoms, you will have constipation and also your tongue will be swollen. The tongue will be enlarged. You will have severe constipation as well. Coming to cardiovascular system, your heart rate decreases and there will be bradycardia. So number of beats per minute is going to be decreased. Coming to nervous system, you will land into depression and somnolence. Somnolence means you will feel sleepy throughout the day. You will be dull, lack of interest in doing any work. You will be slow and there will be sluggish speech as well. Your speech also becomes slow. Coming to female reproductive system, there will be loss of libido. Female will not have the desire to have sex. They become infertile. They're not able to conceive. Polymenorrhea, you will have frequency of menses increases. Instead of having menses for every 24 days, they will have frequently, maybe for 10 days, maybe for 9 days, they will have the frequency of menstruation also increases. There will be menorrhagia. Lot of blood is flown out compared to normal menses. The flow of blood increases and also duration of flow is also increased. Coming to male reproductive system, there will be loss of libido. Libido in the sense they will not have the desire to have sex. They will become infertile, not able to conceive, and also there will be severe erectile dysfunction in case of males, and also there will be impotency. They are not able to produce children. Coming to investigations, it is very important to know the blood levels of T3 hormone, T4 hormone, and also thyroid stimulating hormone, that is TSH hormone as well. And also it is very important to know the sugar levels in the body. you have to do RBS, random blood sugar, postprandial blood sugar, and also preprandial blood sugar, and also HbA1c. It is very important to have all these investigations. Coming to the lipid profile is very important. There will be hypercholesterolemia, where the LDL particle increases. LDL particle increases means it will be more cholesterol, more triglycerides in your body. And also you have to go with ultrasound scan of thyroid gland. So with this, you can say, so which lobe of thyroid is increased, or are there any nodules in the thyroid, or is it diffuse, or the thyroid gland has sunk. All the information will be given by ultrasound scan of thyroid gland. As a thyroid patient, you have to know a bit about anatomy of thyroid, because it helps in understanding the disease bit more. It's even though it takes time, it's very important for you to know these things. Basically, thyroid is an endocrine gland that is located at the base of the neck, lower part of the neck, just in front of the trachea. Okay, it has two lobes, left lobe and right lobe. Each lobe looks like a butterfly wing, and these two lobes are connected with a part known as isthmus. You can consider isthmus as the body of the butterfly, and the two lobes as the wings of the butterfly. And these gland is richly supplied and drained by arteries and veins. It is supplied by thyroid artery. The thyroid artery is a branch of aorta, and it is very richly supplied. Coming to the histology, it is very important for you to know the histology. Our further session depends on this. The functional unit of thyroid gland is follicle. Follicle is a spherical structure. It is a round structure where outer layer of cells we call as thyrocytes, and in the middle of the sphere it is empty. We call it as lumen. Each follicle is richly supplied by arteries and heavily drained by venous drainage. So this is the structure of thyroid gland and functional unit of thyroid gland, that is follicle. And also you have to know about hypothalamus and pituitary. Hypothalamus is a part of the brain which is located in the center of the brain. Just below hypothalamus there is pituitary gland. This pituitary gland is connected to hypothalamus through pituitary stalk, and this stalk contains a series of capillaries we call as portal system. This portal system is the connection between hypothalamus and pituitary gland. This portal system we call as hypothalamo pituitary portal system. Basically, portal system is a network of arteries or veins where it starts as capillaries and ends as capillaries. So the first set of capillaries starts in hypothalamus, and second set of capillaries end in pituitary gland. So this anatomy, physiology and histology is very important for you to understand about the thyroid gland. Coming to the physiology of thyroid gland, you have to first understand how the thyroid hormones are stimulated. It is through negative feedback mechanism. So when there is reduced levels of T3 and T4 in the circulation, so it is detected by hypothalamus. Hypothalamus will detect the low levels and it secretes the hormone, that is thyroid releasing hormone. This thyroid releasing hormone reaches the anterior pituitary through hypothalamo pituitary portal system. When this thyroid releasing hormone reaches anterior pituitary, this anterior pituitary releases thyroid stimulating hormone. This thyroid stimulating hormone enters into systemic circulation and reaches thyroid gland, where this is sensed by thyrocytes, which is located in the follicles. This thyroid stimulating hormone helps the thyroid gland or follicles within the thyroid gland to synthesis T4 and T3. These thyrocytes take the iodine from outside, amino acids, and especially the amino acid tyrosine will be taken by this, and these cells make T3 and T4 are stored within the empty space, that is lumen, within thyroid follicle. When thyroid stimulating hormone is released, these will release T3 and T4 into systemic circulation. T3 and T4 are released into systemic circulation. When they enter the systemic circulation, these T3 and T4, 99% of the T3 and T4 are bound to plasma transport proteins. These plasma transport proteins are produced by liver, and only 1% of the thyroid hormones are in free form, and that is these hormones that reaches every cell. 99% of thyroid hormones are both the T3 and T4 are bound to transport proteins. These are not effective. Only 1% is in free form. This enters each and every cell in the body. In the systemic circulation, 90% of thyroid is in the form of T4. Only 10% of the thyroid is in T3 form. T3 is much more potent than compared to T4. T3 is 7 to 8 times or 5 to 6 times more potent than T4. Normally what happens is, before T4 enters into the cell from the systemic circulation, it is converted into T3, and then T3 enters into the each and every cell of the body, but only very small quantity of T4 enters into the cell, and it is not as potent as T3. So T3 is the active form. All T4 is converted into T3, and then it reaches the each and every cell of the body. And coming to the functions of thyroid hormones has influence on every cell of the body, every tissue of the body, every organ of the body, and every system of the body. So it has major influence on each and every part of the body throughout our life cycle. The major function of T3 hormone is protein synthesis. Means these T3 hormone enters into a cell and it stimulates the DNA to express itself, so that the proteins are produced. Protein synthesis takes place. In that, the first one is functional protein. Functional proteins, in the sense, it helps in making more enzymes, more hormones. Because of this, metabolic rate is also increased, and it helps in synthesis more structural proteins. These structural proteins help in physical and mental growth, and also mental maturation. These structural proteins are very important. Not only structural proteins, these also synthesis regulatory proteins. These regulatory proteins are mainly transport proteins. For example, if anything has to be transported in your blood, it has to be bound with the protein. Those proteins are synthesized by thyroid hormone. Next one is BMR, basal metabolic rate. We all know that thyroid gland increases basal metabolic rate, but what is meant by basal metabolic rate exactly? So thyroid increases basal metabolic rate of every cell except for few cells. Few cells are spared. These are central nervous system, your brain and spinal cord. There is no increase in BMR for spinal cord and brain. And also your gonads, both testes in males and ovaries in females, and also both all the male reproductive organs and female reproductive organs, their BMR is not increased by thyroid hormones. And also spleen and lymphatic system, there is no, there is effect, but the BMR of spleen is not going to be increased, and the BMR of lymph nodes or lymphatic system is not going to be increased because of thyroid gland. These are the structures that has no increase in the BMR because of thyroid gland. Except for this, every cell in our body, the BMR is going to be increased. So what exactly meant by increasing the BMR? Increasing the BMR is increasing the activity of the cell. So mainly, what are all those activities that are increased in the cell? First one is, potassium is taken into the cell, sodium is pushed out of the cell into extracellular spaces. And also the glucose demand of a particular cell, the cell needs more glucose, the cell needs more amino acids, the cell needs more fatty acids, the cell needs more oxygen. The cell, with all these metabolic activities, lot of carbon dioxide is produced. The carbon dioxide has to be quickly removed out, and also lot of waste material is produced. This waste material has to be quickly removed out from the tissues. This is all with the expense of energy. Energy means ATP. So ATP is present in mitochondria. So mitochondria, the size of the mitochondria is increased, the number of mitochondria are also increased. Because of all these activities, lot of heat is produced in the body or in the tissues. That is the reason, when the BMR is high, your body becomes hot. This is what we mean by exactly BMR. In a simple language, it is the increase in the cellular activity. Your cell is functioning more, so you need more energy, more nutrients. All the waste material has to be cleared from the cell. So that is the reason, when more energy is used in the cell from mitochondria in the form of ATP, your cells become hot. They produce heat within the cells, tissues and organs. And coming to gastrointestinal tract, it increases the mobility of the gastrointestinal tract. It produces more waves or more movement in the gastrointestinal system. It absorbs more nutrients from the gut. It increases the nutrients uptake by the cells. Your appetite is increased. It increases the secretions of your GI tract, and there will be glycolysis. There will be glucogenesis. Glucogenesis, in the sense, your glycogen is break down into glucose and it is provided into the cells. It is provided to the cells through blood. There will be lipolysis. Your fats are broke down and fat-free fatty acids are supplied for the cells. And your liver uptakes more LDL particle. Uptaking LDL particle, clearing LDL particle means it is removing the cholesterol from your blood and it is removing the triglycerides from your blood. Removing the triglycerides from your blood. And also there will be gluconeogenesis. Gluconeogenesis is production of glucose from non-carbohydrate sources. Your muscle is breakdown, okay, your fat reserves are broke down, and also lactic acid is converted into glucose. These are all the activities that are carried out by thyroid hormones in our body. And coming to the circulation, there will be hyperdynamic circulation, there will be increased heart rate, there will be the number of beats of your heart per minute increases, and also force of the contraction increases. There will be more blood that is coming out of the heart in every beat. The tissues are provided with more oxygen, all the tissues are perfused, more nutrients are sent to the tissues, more oxygen is sent to the tissues. When there is excessive amount of waste product and CO2 in the tissues, it is completely cleared, all the circulatory system functions better, and also your blood pressure is maintained, and also your peripheral resistance is maintained because of this thyroid hormone. Coming to the respiration, it increases the respiratory rate, it increases the depth of respiration that we call as tidal volume. More oxygen is supplied to the tissues, more carbon dioxide is quickly cleared from the tissues. Coming to the central nervous system, you will become more active and you will become more alert when thyroid hormones are synthesized. Coming to reproductive system, it is very important in maintaining hypothalamo-pituitary gonadal axis, where hypothalamus, pituitary, and your testes and ovaries are connected. They help in regulating this balance. It helps in regulating the periods in females, and also it helps in duration of the flow, how many days the flow has to come, and it regulates the flow itself. So the amount of blood that is coming out during menstruation, everything is maintained by thyroid gland. And also your libido, your sexual drive is maintained by thyroid gland. Your fertility, your erections, and everything is maintained by thyroid gland in your body. Coming to growth, physical and mental maturation, it helps in growth of your bones, it helps in growth of the soft tissue, it helps in both physical and mental maturation. Your height is increased, your soft tissue, your central nervous system development, everything is dependent on thyroid hormone. So what is the reason for this hypothyroidism, especially Hashimoto's hypothyroidism? First one is increased age. With the increasing age, the risk for hypothyroid increases. And also if you are a woman, or being female is one of the risk factor for hypothyroid, because out of every 10 people who is affected by Hashimoto's hypothyroid, 7 people are women and only 1 person is male. And also, and genetically, if your father, mother, or any of your blood relatives have this thyroid problem, you are more prone to get this hypothyroid. And coming to the pathology of Hashimoto's hypothyroid, so you have to know in depth what exactly happening there, so that you can appreciate, you can know whether your treatment is working good, it is not working, or whether you are improving, or you permanently cured by thyroid treatment. So in order to maintain, or in order to understand whether your disease about yourself, you have to know about the thyroid pathology completely. So what happens here is, so normally when bacteria enters into your blood, or some virus enters into your blood, or some pathogens enters into your blood, or some fungus enters into your blood, any foreign body enters into your body, antibodies has to be produced, or your immune system has to fight against the foreign particles. In this particular autoimmune condition, what happens is your immune cells are going and attacking the normal cells of your body. In this case, the thyrocytes, which are present in thyroid gland, in the follicles of thyroid gland, are attacked by this. Antibodies are produced against your cells, that is thyrocytes. And initially there will be inflammation of thyroid gland. So inflammation in the sense, so your thyroid gland is enlarged. There will be transient hyperthyroidism. So as the thyroid glands enlarges in the beginning, so more thyroid hormones are produced. T3 and T4 are transiently increased, but over a period of time, these cells are dead. These cells are going to die, and these cells will be replaced with fibrous tissue, and overall production of T3 and T4 will be decreased permanently. At that time, uh, the patient lands into hypothyroid. That is the pathology of Hashimoto's hypothyroid. Finally, there will be decreased T3 and T4 levels in the circulation. When T3 and T4 levels are decreased in the circulation, what exactly is going to happen in your body? First one is, it is going to decrease the synthesis of the enzymes or proteins. So what are these proteins? So you cannot produce a much hormones, you cannot produce much uh, enzymes. So your structural proteins which are going to be needed for your growth, these are all not produced. And also transport proteins, so the proteins which are used for transporting different material in your body is also decreased. Overall protein synthesis is decreased in the first stage. Your body needs sufficient amount of glucose for it to function. So in this case what happens is, glucose is decreased in the circulatory system. Because glucose is not observed, there will not be any glycolysis. So the glycogen is not converted into glucose and it is provided. And also there will not be gluconeogenesis. There is no usage of fat, or there is no usage of protein, and these are not converted into glucose, and your body is not given the energy molecules that are required. And coming to the fat metabolism, so fat is not mobilized. So both cholesterol and triglycerides are increased in your blood. This may lead to heart attacks. There will be deposition of fat, there will be deposition of triglycerides in subcutaneous tissue just below the skin, and also visceral fat. Visceral fat means the fat which is in your belly is going to be increased because of hypothyroid. Coming to musculoskeletal system, your muscles become weak, the muscles become thin, because there is no proper synthesis of proteins that are needed for musculoskeletal system. Coming to gastrointestinal system, so the peristalsis movements are weak. The gastrointestinal system is not able to absorb required nutrients, maybe proteins, maybe minerals, maybe vitamins, carbohydrate, anything you say, anything, they are not going to be absorbed into the body. Coming to body weight, the body weight enormously increases because the storage of fat, the storage of carbohydrate, the storage of proteins is going to be increased in the body, and there is no clearance of waste material that is produced in the body. Because of these reasons, your body weight is going to be increased. And also due to decreased BMR, what happens is your body is not able to use all these materials and they accumulate in the body. Coming to the circulation, so the circulation is hypodynamic. In case of hypothyroid, your heart rate decreases, the number of beats per minute decreases, your cardiac output decreases, there is no force in the contraction of your heart, systolic blood pressure decreases due to low cardiac output, diastolic pressure remains the same. So overall, your heart is not able to pump the blood that is required to your organs, and it is not able to clear the waste materials that is accumulated in your body. There is no supply of oxygen. And coming to the respiration, your respiratory volumes come down. There is no deep respiration, the respiration is only shallow. You are not able to provide required oxygen for the tissues. You are not able to clear the accumulated carbon dioxide in the tissues. Respiratory rate decreases. The depth of respiration also decreases in case of hypothyroid. Coming to female reproductive system, there is disruption of hypothalamo pituitary ovarian axis. Your hormones go out of place. Your there will be lot of dysfunction regarding to your sexual activity. In the same way, in males, hypothalamo pituitary gonadal axis is disrupted. Because of that, there will be lot of issues with male reproductive system as well. Then coming to the conventional treatment in the sense the regular treatment or allopathic treatment, or the treatment you take from the doctor who is nearby to your home, or when you go to the corporate hospital. All these treatments we call allopathy treatment or conventional treatment. In conventional treatment, they cannot prevent this disease from occurring again and again, and there is no medicine or any technique with them so that they can completely cure this disease. They cannot reverse the pathology. They cannot make the thyroid gland again active and produce normal levels of T3 and T4. They cannot do it. And the only treatment they have is palliative treatment. Palliative treatment in the sense, as T3 and T4 are deficient in your circulation, they will add synthetic or artificial T3 and T4 to your body. This has a lot of side effects. So, and also you will be dependent on those medicines for a lifetime. You have to use those medicines continuously throughout our life. And also, as there is no need for remaining a good thyroid gland, remaining part of the good thyroid gland to produce hormones again, because you are taking the hormones artificially. The rest of the thyroid gland also will be deranged, or it will be diminished. It will sink and it will become useless. We call it as disuse atrophy. So any way you take, there are a lot of disadvantages. And also, after taking this medicine for a very long time, there is no relief for you. Coming to the homeopathic treatment, with homeopathic treatment and also few changes in your lifestyle, few changes in your sleep habits, food habits, and also sleeping patterns and exercise, you have excellent chance to cure the thyroid completely without any side effects. And also there is high chance that the thyroid gland again recovers and produce its own thyroid hormones, and also antibodies against the thyroid glands are not produced, and it is permanent cure. It is possible with homeopathy. How it is possible with homeopathy? In homeopathy we use a treatment by a name constitutional treatment. Your constitution is manifested in three forms. It will be manifested in physical characters or physical symptoms. So thyroid gland is enlarged. This is a physical symptom. So you become emaciated, or you become obese. These are all the physical symptoms. And physiological symptoms here, the thyroid function is decreased, antibodies to against the thyroid gland is produced. These are all functional changes. And also psychological changes. You may lead into depression. You may lead into any other suicidal tendencies. So any changes that occur at the mental level are psychological changes. So any disease you get, it is because of two reasons. One, you get some part of it from your genetics, that is your forefathers. Some part of it from your habits, that is external factors, like how you are eating, how you are sleeping, how you are exercising, and how you are leading a stress free life. So combination of your genetics and combination of what you have acquired from the outside is your constitution. Based on this, we prescribe a constitutional medicine, so it elicits a hormetic response in your body. Because of the hormetic response, your disease is completely cured, and it will not occur again and again. We call it as cure. In very rare cases, so where you have disease for a very long time, there is a lot of physical damage is done in your body. At that time, we can give palliative treatment. We cannot cure completely, but it's very rare. Normally we completely cure it, and that too, even that palliation is without any side effects. So why homeopathic medicines do not have any side effects? So homeopathic medicines are basically nanoparticles. This nanoparticles, it contains an active ingredient in the center. It is surrounded by lactose molecules. On top of it, it is coated with silicon coat. This is a nanoparticle. This is very advanced technology of making medicines. These nanoparticles, when introduced into your body, so they will not have any off targeting. So where there is disease, they will go and act only in that place. When the medicine acts at other places than it has to act, then only will have side effects. So that we call it as off targeting. In homeopathy, we do not have off targeting. That's the reason you have no side effects in homeopathy. And also, the medicines you take in homeopathy is very low doses. In allopathy or ayurveda, you take medicines in grams and milligrams, but in homeopathy it is only few picograms, few hundred to 1000 picograms. It is very less compared to the dosage of any other system of medicine. So that's the reason you don't have side effects in homeopathy. And what about the efficiency? How effective are the homeopathic medicines? Homeopathic medicines are very effective than compared to any other system of medicine, because homeopathy medicines works on the principle of hormesis. Principle of hormesis says, any substance you take in the world, you take water even in higher quantities, water can act like a poison. If a person takes plenty of water, he may die. And also, even the snake venom, when you take in smaller quantities, it acts as excellent medicine. That we call as hormetic principle, hormesis. So when there is small derangement or small stress to your body, the body works against it to cure the disease. In the same way, these nanoparticles elicits a hormetic response. So it has an excellent medicine to cure your thyroid problems. On its own, gland will start producing its thyroid hormones again, and also antibodies against the thyrocytes are reduced completely, so that your thyroid glands recovers quickly. So this is how the homeopathic medicines are very effective. And homeopathic medicine treatment is very affordable, because there is no patenting rights in homeopathic medicine. For example, if you take allopathic treatment, if any allopathic pharma company makes a particular medicine, so they will be given exclusive rights to sell that medicine for 7 to 9 years with their desired price. There is other pharmaceutical companies cannot make those medicines. That is patent rights. In homeopathy you don't have patent rights, so every pharma company can make the same drug and can sell to their desired price. As there is competition among themselves, the overall price of the homeopathic medicine is reduced and it is very affordable to general public than compared to allopathic system of medicine. And coming to the precaution, what are the precautions you have to take for a thyroid? There is a lot of misconception that you should not be eating soya beans, you should not be eating cruciferous vegetables like broccoli, cabbage, cauliflower, or Brussels sprouts, turnip, or leeks, or kale, or you can eat them, but you have to cook them well because some of them may contain nitrogenic substances. That's the reason you have to cook them well and you have to eat it. And also there is one more misconception that you should not be taking whole grains because whole grains contain gluten. It is garbage. You can take whole grains. And also coming to, some people say you should not be eating onions, you should not be eating berries, so it is all garbage. You can take plenty of onions and berries as well. There is no problem. And coming to the diet, what type of diet you have to eat for thyroid problem? So you have to always consume low carbohydrate diet, and you should have medium amount of proteins and fats in your body. You have to have high amounts of minerals, high amounts of vitamins. You should take high fiber in your diet, and also take adequate amount of water. Ensure that your diet has probiotics, your food is always organic, and you should eat a variety of food. You should not be sticking to only one kind of food every day. And also you have to eat unprocessed food. Processed food is not good for health. You have to always take fresh vegetables. You have to take the food in less frequent intervals. You should not be eating food continuously throughout the day. And also it is advised to take intermittent fasting. Fasting is very good for your health. And what you should not be eating: do not eat genetically modified organisms or GMOs. Don't include inorganic foods or artificial foods, or you should not be eating artificial sweeteners or artificial colors. And coming to food groups, you have to reduce cereals and millets. Reduce cereals and millets as low as possible. You can take plenty of pulses, plenty of vegetables, seeds, nuts, and also if you are above 35 years of age, you have to reduce fruit consumption as well. And also you can take plenty of meat, eggs, spices you can take, and also condiments, fats and oils. Coming to fats and oils, reduce saturated fats. Saturated fats are rich in animal foods, mammalian foods, but you can take plenty of fish. Coming to the oils, stop refined oils. Do not use refined oils. Always take cold pressed oils. This is about diet. And coming to the sleep, have at least 7 to 9 hours of sleep. There is no organ system in our body that is not rejuvenated by having good sleep. Good sleep is very important. So your stress levels are decreased. Your autoimmune condition will also increase because of good sleep. And coming to the exercise, so there are plenty of exercise you can do. So you can do, first important exercise is zone 2 cardio exercise. Zone 2 cardio exercise is the minimum exercise you have to do, and it is one of the most important exercise. Zone 2 cardio exercise, in the sense, you can walk, you can cycle, or you can swim, but you should be, the intensity is so maximum that you should be breathing in through your nose and breathing out through your nose. You should not be opening your mouth and start a respiration. When you go into huffing and puffing, or if you go into anaerobic mode of respiration, what happens is their carbohydrate becomes a substrate. But in order to burn fat in your body, you should not be breathing through your mouth. The intensity should be, the carbon dioxide exhaling through your nose should be sufficient. That is the maximum amount of intensity of exercise you have to do. Once you have mastered this exercise for over a period of time, at least 3 months, then you can go with medium duration endurance or long duration endurance. You can start on strengthening exercises, you can start on speed related exercises, power related exercises. Those are all at later stages, but initially at least you have to do zone 2 cardio exercise. And coming to the lifestyle, so always live a stress free life. Whatever the stress may be in your life, try to come out of it. Live in a place where there is no pollution, and be as close to nature as possible in your life. Coming to the prognosis in the sense, what happens when you don't get treated properly, or if you are on irregular treatment for thyroid problem. So it may lead to infertility, you are not able to produce children. It may lead into obesity or even heart attacks at some times. There is a serious condition called myxedema. What happens is your metabolic rate is seriously decreases. your protein synthesis is decreased, you are not able to use carbohydrate, fat or proteins in your body is knocked with all waste material, there is no pushing the waste material out of your body, so it accumulates in your body. Finally it leads to death. So 50% of the people who are having mixed edema are going to die because of this disease. We are physically located in Manikonda, Hyderabad, but wherever you are in the world, you can take online consultation, you can share your reports through electronic media, we can ship your medication to your doorsteps wherever you are in this world. We are shipping to all the continents in the world and also all the nook and corners of India. So don't worry, you can take treatment with us both in person and online as well.